Over mother and baby and what you need to know for the NCLEX. Nothing more and nothing less. No fluff. Let's go. You are feeling overwhelmed by the labor stages, the fetal monitoring, and newborn care. Don't worry. I'm going to help you with your NCLEX prep. So first, stages of labor. There are 4 stages of labor. The first stage is where the cervix is dilated from 0 to 10 centimeters. Stage 2 is when the baby is actually delivered. Stage 3 is when the placenta is delivered. Stage 4 is the recovery phase. NCLEX tip you need to know for this is watch for any deceleration, because that's bad. That happens, I want you to think placenta insufficiency. Late decels is a gradual lowering of the fetal heart rate. The meds you need to remember for this is your magnesium sulfate. This is used for preeclampsia. And remember, preeclampsia is your high blood pressure, your edema, and your proteinuria for the mom. With your magnesium sulfate, because it's magnesium, you need to monitor for reflexes and respirations. Your oxytocin or your pitocin medication stimulates the labor. You need to monitor your contractions and the fetal heart rate. Terbutaline is your next medication. This is going to stop your contractions, but this can cause tachycardia. So monitor the heart rate of both the mother and the fetus. Next, I'm going to go over prenatal care. You need to let your mother know that she needs to take folic acid supplement. She should be taking 400 to 800 micrograms daily. This is to prevent neural tube defects. You always need to be monitoring their blood pressure for preeclampsia. Educate them on the signs that need to be worried about and reporting to their doctor. So this is going to be bleeding, severe headache, decreased fetal movement. You are going to perform fetal fundus measurement, which is like the height of the belly, after 20 weeks. Labor and delivery nursing care is going to be monitor your fetal heart rate. The normal range is going to be 110 to 160 beats per minute. If you start noticing late deceleration, I want you to do this intervention called Lion. You're going to place them on their left side. You're going to give them IV fluids. You're going to administer O2, and you're going to notify the provider. Left side, IV, oxygen, notify provider. You obviously need to be assessing the contractions. What is the frequency? How long are they going? What is the intensity? Provide your comfort measures like breathing exercises. Pain relief, obviously if they have an epidural. When they get vaginal exams, those are sterile procedures. They're checking dilation, effacement, and the station. Those are all the baby's positioning in the vaginal area. You're going to perform your APGAR score at 1 and 5 minutes. Right away, they're going to get a vitamin K vaccine. This is given to prevent bleeding. Erythromycin ointment on their eyes to prevent any infection. Make sure you're educating the mother on having the baby sleep on their back, no loose blanket, and on a firm surface. This is all I have right now. The priority things for mom and baby is going to be, you need to prioritize safety of the mother and the baby. You need to know the normal and the abnormal vital signs for mom and the newborn. You need to be prepared to act quickly for complications. NCLEX loves to teach you on postpartum hemorrhage, fetal distress, and preterm labor questions. So make sure you save and share this out. I hope that helps, and happy studying.